I now invite the distinguished laureates to deliver their respective acceptance statements. Inviting the institutional category laureate to deliver her acceptance statement, I give the floor to Mrs. Ann Stars, President of Family Care International. Give the floor.
Thank you. Dame Billy Miller, Undersecretary General, Chairman of the Committee, Mrs. Obeid, family and friends, and distinguished guests. 2007 was an important year for women. I hope and expect that 2008 will be a momentous one. Last October, the Women Deliver Conference brought together nearly 2,000 participants from 115 countries to say to the world, clearly, loudly, and with passion, that women's lives matter. The world listened and responded, and a profound change has begun. For more than 20 years, Family Care International and many dedicated partners have been calling for action and taking action to address one of the world's most profound injustices, the enormous risk of death and disability faced by women in developing countries every time they become pregnant. In the poorest countries in Africa and Asia, women may have to walk for hours to even reach a basic health facility, and the services those facilities offer are often abysmally poor. As a consequence, 1 out of every 8 or 10 women in these countries may die from the complications of pregnancy and childbirth, and many more will develop serious, sometimes permanent disabilities. In the richest countries of Europe and North America, only 1 out of every 20,000 women will die from these complications. In other words, a woman in Africa may be 2,000 to 3,000 times more likely to die in pregnancy and childbirth than a woman in Northern Europe. There is no other health indicator with such an enormous gap between countries. And the gap is echoed within countries where rural, poor, and uneducated women face a much higher risk of death than their urban, wealthier, and more privileged counterparts. These numbers and this inequity have not improved significantly in the past 20 years. Their persistence is both a source of shame and a stimulus for action. But there are 3 changes that began in 2007 that I believe will enable us to mark 2008 as the year we stepped on the road to victory, the year that the 5th Millennium Development Goal, improved maternal health, began to receive the attention it so urgently needs. The first change that began last year is that we looked concretely at what happens to children, to families, to communities, and to nations when a woman dies. We have all seen, in a husband's heartbreak and in a child's tears, what it means to lose a young mother. But last year, we pulled together the hard evidence and presented it in the cost-benefit language that resonates with decision makers. At the family level, the death or disability of a woman causes severe hardship for any children, especially girls, that she leaves behind. If she dies after giving birth, her newborn infant's death sentence is almost certainly written. At the national level, in a country like Uganda, maternal and newborn deaths have a huge economic cost, $80 to $100 million annually in lost productivity. Globally, the 500,000 maternal deaths and 4 million newborn deaths that take place each year lead to an estimated $15 billion in lost productivity. The theme of the Women Deliver Conference, Invest in Women, It Pays, highlighted this critical message that ensuring the survival and well-being of women and mothers makes sound economic sense. In addition to this economic argument, there's also a growing acceptance that women have a legal and a moral right to the health services that are essential to saving their lives. Women's groups and other civil society organizations are increasing that governments and donors be held accountable for the policies they proclaim and the promises they make, demands for action and for money that must and will be heard. The second change that I believe will put us on the road to achieving Millennium Development Goal 5 is that the maternal health community has agreed to and articulated 3 strategic pillars that are critical for improving maternal health. These pillars are first, comprehensive reproductive health care, including family planning and other services to enable women to regulate fertility, avoid HIV and other sexually transmitted infections, and prevent and manage unsafe abortion. The second pillar is skilled care during and after pregnancy and childbirth, provided by healthcare professionals, ideally midwives, who have the essential skills and who work within an effective, functioning health system. The third pillar is emergency care for the main life-threatening complications that kill women and their newborns every minute of every day. Adding a fourth pillar, postnatal care for the mother and newborn, will ensure that women and their infants receive adequate care in the critical hours, days, and weeks after delivery as well. The agencies, organizations, and governments working on maternal and newborn health need to speak with one voice and work together to implement these pillars. This work must in turn link up with efforts to strengthen health systems, to involve communities, to respect women's rights, and to prioritize the needs of the poor and the marginalized. The third change that has helped maternal health has been the coming together of the maternal, newborn, and child health communities under the banner of the continuum of care. For too long, the maternal and child health communities have worked in isolation from each other and sometimes in competition, to the detriment of both. Over the past few years, recognition has grown that the health of mothers, newborns, and children are inextricably linked, and we have seen the value of forging synergies between programs that serve mothers, newborns, and children. As reflected in the establishment of the Partnership for Maternal, Newborn, and Child Health, and is demonstrated in the Countdown to 2015 conference held last month in South Africa to track progress toward MDGs 4 and 5, the maternal, newborn, and child health communities are advocating together, working together, and evaluating together more and more effectively than ever before. In the spirit of the continuum of care, last month, the maternal, newborn, and child health community jointly issued a specific and urgent call. We need an additional $10 billion by 2010 to put us on the road to achieving MDGs 4 and 5. If that level of funding can be mobilized from donors and governments and invested now in the services that we know are critical to saving lives, the targets that were set for maternal health and child survival can be met. Half of that total figure, $5 billion, is needed specifically for maternal and newborn health, including family planning, to ensure that essential elements, such as adequate numbers of skilled health workers, as well as commodities and infrastructure, are in place. We hope that UNFPA's thematic fund for maternal health will make a major contribution towards this goal. The U.S. House of Representatives just yesterday adopted a resolution calling for more resources to reduce maternal mortality in the U.S. and throughout the world, and recognizing maternal health as a human right. We hope that this resolution will be followed by others that allocate significantly greater funding from the U.S. government. For Family Care International to receive this award is, I believe, a clear recognition by the United Nations community that the time has come, as Secretary General Ban Ki-moon said last week in Atlanta, to put a stop to these senseless deaths and make the process of giving birth safe for mothers. It is a privilege for me to accept this honor on behalf of many. First, FCI's founding president, Jill Sheffield, whose energy, commitment, and vision were key to launching and nurturing a movement to save women's lives. Second, all of FCI's staff, here in New York and in the field, whose tireless work to educate women and their families and adolescents and to train health workers has helped to empower communities and strengthen health systems throughout Latin America. And third, the partners and colleagues who have worked side by side with us and whose courage, determination, and insight have brought us this far and will take us the rest of the way. This is our year, the year that we deliver on the promise we made to the women of the world, to value their lives and enable them to deliver on their potential for the sake of their children, their communities, and most of all, for the women themselves. Thank you.